Hey guys, it's Dr. Kamel, and we're going to continue on with our ultrasound series, and now we're going to discuss the plantar plate. So, the plantar plate has been associated with forefoot pain as well as deformity. And the plantar plate is a broad and thick ligamentous structure that spans the metatarsophalangeal joint. The proximal, more mobile attachment of the plantar plate blends in with the metatarsophalangeal joint capsule and into its insertion into the proximal phalanx base. It is important to know this structure because its pathology is related to metatarsalgia, plantar swelling, deformity, as well as subluxation of the lesser toes. So now I'm going to show you guys how you can use the ultrasound to identify the plantar plate as well as any pathologies related to it. Alright, now I'm going to show you guys how you can use ultrasound to identify plantar plate anatomy as well as any pathology. So we'll start in the long axis, which will have the probe in line and parallel with the long axis of the foot. And I'm going to look at the plantar plate of the second ray. So right at the second metatarsophalangeal joint. So right there you can see the metatarsal head and the proximal phalanx base. And so in the long axis, the plantar plate is typically going to appear as a grainy but homogeneous and slightly echoic band, and it extends from the proximal insertion of the plantar aspect of the distal metatarsal shaft. You keep that right there. To the base of the proximal phalanx. Now the flexor tendon, you'll see, overlies the plantar plate on the longitudinal view. You can see that with the fibular structure right there. The tendon is fibular, it's distinct, and it's separate from the plantar plate. The hyaline cartilage, you can see here, is seen as a thin hypoechoic line against the bright line of the cortex of the bone. So you have the hypoechoic hyaline cartilage. Just above that you have the plantar plate, and then you have the flexor tendon. Now let's look at it in the axial view. The axial view is going to be a little bit more difficult. So you have the proximal phalanx base, metatarsal head right there. And it's going to be just a slight homogeneous, slightly echoic band of tissue. The plantar plate will appear as a curvilinear structure that lies right above the metatarsal head base and the metatarsal head and base of the proximal phalanx. So it's a little more subtle, but you can delineate it's just right above the hyaline cartilage. So right there on the metatarsal head, and then into the proximal phalanx base. It's really hard to see and it's really subtle, but if there was any pathology, you'd see something different from this. And I'm going to show you guys just some images, different examples of some pathologies. Thanks. And you can see this beautiful image of a longitudinal axis of the plantar plate, the metatarsal head, the phalanx, the plantar plate, and the flexor tendons are all visible in this image, as well as the hyaline cartilage. So you can see that the metatarsal head has the hypoechoic layer just above it, which is the dark layer just above the metatarsal head on the bottom right of the image. That is the hyaline cartilage. Just above the hyaline cartilage, or which would be plantarly anatomically, is the plantar plate. And you can see that it's normal and intact, starting from the metatarsal head and going all the way over to its attachment into the proximal phalanx base. Alright, and here we see a short axis view of the plantar plates for the metatarsals 2, 3, and 4, indicated as M2, 3, and 4. The plantar plates are indicated as the PPs with the arrow, and the Fs are indicated as the flexor tendons. And I like to think of these as basically hamburgers. The metatarsal head, as you can see, the curvilinear structure, has the hyaline cartilage layer, the hypoechoic or dark layer, curvilinearly around it, and then the next layer above it is the plantar plate, And then just above that is the flexor tendon. This is a great view to see the anatomy of the forefoot. Whereas the last short axis view was the plantar plate at the level of the metatarsal, here you can see the plantar plate at the level of the proximal phalanx base, also in the short axis view. It's a little bit harder to identify, but you can see that the PP is indicating the plantar plate, the F again indicating the flexor tendon, and the BP3 is the base of the proximal phalanx 2 and 3. Now, I want you guys to take what we've reviewed in the previous images and apply it to these. Let's take a look at image number 1. You can appreciate the normal anatomy. Now, if we take that and we compare it to the image just below it, it's the same long axis view, but you can see, indicated by the 3 yellow arrows, that there's a discontinuity in that homogeneous echogenic plantar plate just before its insertion into the proximal base. Now let's go over to image number 2 with the intact short axis view of the plantar plate. What's interesting, if we look down at the image below it, you can see that there's a partial lateral tear. Now, if you were looking at this this plantar plate on the long axis, and you happen to have your probe more on the medial side, you may have missed this tear, and you would think that, oh, well, this image looks like just like image number 1, and it looks like it's intact, but it may have a tear on one side or the other. So it's important to use this short axis view to identify the entire medial to lateral aspect of the plantar plate insertion. And then if we take a look at image number 3, we have a partial medial tear, which is kind of exactly what we were looking at in the partial lateral tear. But I want you to see how the difference between that medial tear and what a complete tear would look like, indicated by the 4 arrows on the bottom right image. There is just complete discontinuity and no attachment along the entire curvilinear aspect of the bone. Here's a great image illustrating a plantar plate tear. This is a longitudinal view, and you can see, as indicated here with the colors, that you have the discontinuity of the homogeneous echogenic plantar plate, which you were able to identify in the normal, now has a lack of that homogeneous echogenicity, and now you see more of an echogenic or dark disappearing basically of where the plantar plate is supposed to attach at the proximal phalanx base. And this is indicative of a tear. Thank you guys for watching. Hope you learned something. Until next time.